Hello everyone, my name is Jenny Hall, and today I'm going to be talking about autologous fat grafting as primary breast reconstruction after mastectomy and its effects on longitudinal BMI. I have no disclosures. Obesity is on the rise with a prevalence that now exceeds 30%. Obesity is of particular concern in breast cancer patients as it is associated with an increased rate of surgical complications, mortality, and breast cancer recurrence. It's important to recognize that on average, breast cancer patients gain weight at a faster rate and to a larger magnitude than the general population. A recent study showed that autologous breast reconstruction is associated with less weight gain compared to patients who do not undergo any type of breast reconstruction. So the aim of this study is to evaluate if the use of total autologous fat grafting for primary breast reconstruction after total mastectomy has an effect on the patient's BMI. This is a retrospective review of a single center which included patients who were diagnosed with breast cancer and subsequently underwent total mastectomy followed by either total autologous fat grafting, which included 12 patients, or flat-based reconstruction, which included 185 patients. For our methods, we collected patient BMI at 6 months post-reconstruction and then annually up to 6 years. Percent change from baseline BMI was then subsequently calculated for each time point. Analysis was performed to determine if there was a significant difference in BMI change between the fat grafting and flap reconstruction groups. Looking at our patient characteristics, there was no significant difference in smoking, chemotherapy, or radiation status between the groups. However, there was a significant difference in baseline BMI since the fat grafting patients tended to be thinner, with an average BMI of 24.1 compared to the flap group, which had an average BMI of 29.9. This point is reiterated by the figure on the right, which shows that the fat grafting patients represented in blue were most commonly of normal weight, whereas the flap group represented in orange was most commonly overweight. Of note, the fat grafting group was significantly older, with more of the patients being postmenopausal. Additionally, the fat grafting group was almost all done as delayed reconstruction, whereas the flaps were immediate reconstructions. Looking specifically at the fat grafting patients, 7 underwent unilateral and 4 underwent bilateral reconstructions. On average, patients underwent 3.7 fat grafting procedures over the course of 1.4 years. The average volume injected per breast per procedure was 187.6 mLs for an average total volume of injected per breast of 866.3 mLs. This is a graphical depiction showing how weight changed over time. The orange line represents the flap group, which trended on weight gain, and the blue line represents the fat grafting group, which trended on weight loss. Pearson correlation coefficients showed a significant correlation between weight change and time for both groups. Now looking at the percent change in BMI, there is the same trend as weight gain such that on average the flap group had an increase in BMI, whereas the fat grafting group had a decrease in BMI. When the percent BMI change was compared between the groups at each of the time points, the fat grafting group had a significant decrease in BMI compared to the flap group at both 3 and 5 years post-reconstruction. We looked to see if there is any correlation between the number of procedures or volume injected and weight change. However, we did not find any significant correlations. In conclusion, we found that the fat grafting patients tended to be thinner and older than patients who underwent flap-based reconstruction. The flap-based reconstruction patients on average tended to gain weight, and the fat grafting reconstruction patients on average tended to lose weight. Breast cancer patients should all be counseled on the risk of weight gain after diagnosis. However, reconstruction type should not be determined by the risk of weight gain. Just to mention a few limitations, this was a small sample size for the fat grafting group of only 12 patients. Additionally, there was a difference in baseline BMI, age, menopausal status, and timing of reconstruction between the two groups. Thank you so much for your time.